Welcome back to the Diabetic Foot Files, where we uncover the most important and often overlooked aspects of diabetic foot care. I'm Gabby, aka Dr. G, or you can just call me by my formal name, Dr. Gabrielle Hutcheson Donaldson. I'm a DPM, podiatrist, and wound care specialist. Okay, DPM, podiatrist go hand in hand, and a wound care specialist, and I'm fascinated with diabetes. So, corns, calluses, and dry skin is something that most people ignore. These might seem like minor cosmetic issues, but for some people with diabetes, this could be the first step towards a foot ulcer, infection, or even an amputation if not properly managed. So, hopefully, by the end of this episode, you'll know how to spot, treat, and prevent these silent threats before they turn into something serious. So let's always start with a case study. Let's start with a story that proves how dangerous ignoring a callus and dry skin can be. Meet Lisa, a 55-year-old female with not diabetic, type 2 diabetes. She has a thick callus on the bottom of her foot for months. It didn't hurt, so she didn't think much of it. One day, she noticed a small blood stain on her sock, but still felt no pain. A few days later, the callus turned into an open sore underneath. And what is it now? Now it's called a diabetic foot ulcer. She saw her doctor, who told her that it was infected, and then within 2 weeks, the infection did spread to her bone. Unfortunately, once the infection spreads to your bone, something that you will hear often is somebody will say amputation because infection of the bone is difficult to treat without removing that part of the infected bone. Bacteria is very strong and it ends up eating away at the bone. You'll see that in x-rays. She is so what happens is that part of the infected bone, she needed that part amputated, all from where the callus first started. I know it seemed harmless at first, but look what happened in the end. So Lisa's story isn't rare. Diabetics often don't feel the same way as we do due to what we call neuropathy. So these small issues like calluses, corns, or dry skin turns into open wounds without them even realize it. So let me break it down. Why do these common foot problems turn into serious medical complications with people with diabetes? Number one, corns and calluses. They are the hidden risk for ulcers. So what are they? Corns are thickened areas of the skin that develop due to friction, usually on the toes. You see it like with the people who have hammer toes. Then there's calluses, which are hardened layers of skin from repeated pressure, usually at the bottom of your foot. Why are these dangerous? Because they hide wounds underneath them. The pressure keeps damaging the skin, leading to breakdown and ulcers. People with neuropathy usually don't feel that damage happening. That's why when she saw the blood in her sock, and she still didn't feel pain, she didn't still put any mind to it. But that is bad. You should have went to your doctor right away, even before it turned into an open ulcer. But there was most likely an ulcer underneath for her to have blood there. Number two, dry, cracked skin, the bacterial entry point. So, what happens when dry skin develops, you get cracks. There's like when you get cracked lips. So we usually, as a podiatrist, we usually see these cracked skin usually along the back of the heels. We call it heel fissures. So these cracks allow bacteria to enter and that leads to infection. Sometimes you also get a fungal infection like athlete's foot and they thrive in those cracked areas too that can worsen the problem. So sometimes when you see a heel fissure, you have to treat it for bacterial skin infection and fungal skin infection. So why are diabetics at higher risk? Like mentioned in the last episode, when you have a higher blood sugar, you also impede or weaken your immune system. But also a high blood sugar also dehydrates the skin, make it more likely for the cracks to get worse. And also diabetes affects that autonomic system, so you're prone to having dry skin. And then poor circulation when the skin doesn't have enough nutrients to stay healthy. Uh, so this is why daily foot care is important. A simple callus can turn today into an ulcer tomorrow. So what we should do if an ulcer left untreated, it could turn into an amputation. So key point today is if we see a callus or any area of pressure or thickened skin or redness, please go to your local podiatrist so that we can prevent an ulcer or amputation. So, how can we prevent and treat this? Okay. So, now we know the risk. Now we're talking about the solution. So, to prevent corns, calluses, and dry skin from turning into major problems, number one, daily moisturizing. We keep the skin soft but smart. But smart. So you use a diabetic safe moisturizing lotion. Please do not put it in between your toes. Our toes, in between our toes, are nice and warm. That's how a lot of people get fungal infections. Do not put lotion in between your toes. End of story. And then also focus on the dry heels and dry skin areas. If there's dry skin in between your toes, which is extremely rare, but I have seen it, go to your podiatrist. There is something else to treat it. It's not going to be the lotion. And do not apply the lotion in between your toes. That would lead to a fungal infection. Number two, never treat the calluses or corns yourself. So, what not to do? Never cut them yourself. This can lead to the open wound and infection. And also, the biggest thing I always tell patients, please avoid the medicated corn remover pads. I've had so many patients that developed an ulcer from the acidic corn pads. They have so much acid in it, it damages the skin. It doesn't know how to differentiate from good skin to bad skin. It's supposed to eat away at the thickened skin, but it also eats away at the healthy, normal skin. So, what to do? See your podiatrist for safe removal and wear proper shoes that will reduce friction and prevent new ones from forming, like the calluses. But I wish people understood how important biomechanics plays a role with calluses, corns. Anytime I see a callus or corn, the very first thing I think of it is biomechanics. Where are the biomechanics off? Where do I need to offload? Where is the pressure coming from? Something happens also with diabetics. They get something called intrinsic minus foot. That also makes them have these claw toes, and that can cause a lot of pressure on the forefoot, causing calluses and corns on the top of the toe and the callus at the bottom. So keep these little things in mind, but just as a pearl for the pod students, intrinsic minus foot, look it up. We'll talk about it later though. Number three, wear proper and right shoes so we can reduce the pressure. So shoes that you need to avoid are tight shoes or shoes that are too loose. So too tight or too loose. When they're too tight, they're going to create the friction and the calluses. And if they're too loose, you're going to also develop a callus because your poor foot is trying to keep it plantar grade, what we call just like flat on that shoe. You're going to make your foot overwork if you have a shoe that's too loose. So, and then no high heels and no flip-flops. I do not agree with flip-flops. Another thing that constantly happens is summertime. Summertime is usually a busy time for podiatrists and also wintertime, but summertime, people like to go to the beach and walk in their flip-flops and get little first, second degree burns on the bottom of their feet. So keep that in mind. And the best choice that I can recommend for a diabetic is a nice wide toe box shoe so that it's wide, there's no tightness on the sides of your foot, and it's deep and wide. And then a softened cushion insole that can prevent pressure. A lot of diabetic insoles are soft and cushion. So number four, regular, daily, not even regular, daily foot inspections can catch the problem early. Like I'm going to say, I probably will say this in every episode, the 60-second rule. Check your feet at the end of the day for 60 seconds. If you have a mirror or family relative, to check your feet every day at the end of the day, no socks on, and make sure you check in between the toes too. A lot of wounds like to hang around in between the toes. So you check for thickened skin, early callus formation, go to your podiatrist. We're going to get rid of that real quick. The earlier you come, when you see any changes in your skin, the less likely you will develop any major skin complications such as an ulcer or even have an amputation. So the earlier the better. Prevention is better than cure. And make sure also look for any areas of redness. Do not wait till you do develop a blister even. If you see an area of redness, that means there's too much pressure. So, what do you do when you do see all these things happening at the bottom of your foot? What do? You want to treat it yourself? Absolutely not. So, when do you need professional care? The simple rule is if you see a problem, don't wait. So, see the doctor immediately, your local podiatrist. A callus that is turning red, swollen, or draining fluid, cracked heels that aren't healing, and a corn or callus that starts bleeding or changing color. So Lisa's story is a wake up call for all of us. What seems like a minor issue can turn into a major medical crisis if it's ignored. But the good news is you have the control. I always tell my diabetic patients they're in control, even when we're in the hospital in the ER. These are all your choices. I'm going to present you all the treatment options that are available to help get rid of this or to treat this. But it's at the end, it's still your choice. And the biggest thing is at the end of the day, when you leave the clinic or the OR or the hospital, your your compliance plays a huge role in preventing this ulcer from coming back or preventing any major complications or progressions. So checking your feet every day, keeping moisturized, and seeing your podiatrist on a routine basis. Usually, when I have a diabetic that has a callus or corn, I always ask them, first of all, how long does it take for the callus to develop after you shave it down? Because they usually have tried to shave it down before they came to the doctor. So some people take me 1 month, 2 months, 3 months, six, it depends. But I usually, when I see a callus, I want to see it monthly. I want to make sure that it's gone. And like I said, you cannot treat a callus without treating the biomechanics of the callus. Please keep that in mind. And so I hope you found this episode helpful. Share it with someone who has diabetes. I want us all to work together to reduce amputations and save lives. And don't forget to subscribe to my podcast, The Diabetic Foot Files, for more expert advice on keeping your feet healthy. If you have any questions or a topic you'd like me to cover, send it in. I'd love to hear from you. And then until next time, take care of your feet. They take care of you. Have a great day. Bye. Day.